as well. We'll talk to Dr Karen Phillip, family counsellor and clinical psychotherapist, for our regular chat, and also taking your calls 131873. If you've got a question for Karen, get on the phone right now. It might be how hypnotherapy can help you, some problem you're having in your life, and how you can overcome that problem. If you need help, need a bit of a leg up, get on the phone right now. That's the number to call, 131873, or email us via 2gb.com or 4bc.com.au. How are you, Dr Karen Phillip? Well, we talked about a number of different things, or themes, I suppose, I could say, over the last few weeks, particularly to do with clinical hypnotherapy and also counselling. And we've looked at people overcoming problems with addictions, of smoking, weight loss and those sorts of issues. But tonight you wanted to talk about pain.
Yeah, pain affects about 1 in 3 people, unfortunately, and if we add the emotional, physical and financial strain for the sufferer and the family, those that are affected by chronic pain is considerably higher. So it unfortunately affects so many of Australians.
It does, doesn't it? And yet it can be so debilitating in the way that they live their lives, not just because they're in pain, but also their ability to just live a normal life in general.
Oh, gosh, yes. It can be so restrictive to all areas of our life. I mean, the research tells us that chronic pain costs Australia $35 billion annually, and a lot of that, apart from the healthcare, is to do with lost productivity at work as well. And
it's also just the way that people look. How it ages people is incredible. Somebody who's in constant pain, how much it ages them over a short period of time.
It really does. It's awful. I mean, I can't really even imagine living with pain ongoing day in and day out, but people unfortunately do. They live with pain for months, if not years, and it just doesn't seem to be getting much better from everything that I've read. I mean, we've got, we have pain clinics and we have this and that help, and we have lots of medication. The government's even trying to place a lot of our paracetamol medication, our codeine medication, Nurofen type of medication on prescriptions because so many people are consuming them on a daily basis. It's quite scary.
Yeah. Well, look, that side of it's nothing new, really, isn't it? I mean, it used to be the saying, have a Bex and lay down. And, of course, we found out that having a Bex or a Vincent's wasn't very good for your kidneys, as it turned out. And thankfully, pain medication now is significantly safer. But,
It is safer, but it still can have quite a detrimental effect on the liver and the kidneys over time, which is what we're finding. So, I mean, obviously the best way is to not be in pain and therefore to be able to handle it. But it's the chronic pain that we're concerned with rather than the acute pain. So in other words, it's the long-term pain that lasts for months.
That's right.
It's the main problem for people, unfortunately.
Yeah, 131873 is our number. Dr Karen Phillip, a family counsellor and clinical psychotherapist. I tell you what is interesting when it comes to that scenario is that the pain, in many cases, it will be there forever, won't it? If it's something to do with a back issue or some medical condition that can't be easily solved.
Well, it's interesting because medical science has yet to understand why one person may be susceptible to feeling pain while another person with the same condition doesn't feel the same degree of pain at all. You can have identical injuries or conditions yet experience different levels of pain. And we really haven't been able to figure that out. It's not that one person is weaker than another, not by any stretch. It's just that a lot of it's to do with our emotions. They say that emotional, unfortunately, people with emotional concerns and debilitating concerns such as depression, anxiety, grief, that sort of thing, do suffer pain more than those that don't experience those emotional problems.
So do you think in some cases it's a matter of mind over matter?
A lot of the times it is, not every time for sure, but unfortunately if we do accept that part of it is in our head, then that really opens up the opportunity for us to change things and take charge and allow us to understand that we actually have the capacity to do something to reduce it.
Yeah.
And I work with a lot of people in the rooms that do come in with long-term pain, and what we find is that a lot of people that come in, they focus on their pain on a daily basis. Obviously, they're in discomfort, but they focus on it all the time. And when we continually focus on something, it usually escalates. But what we do is we put them into a position where we take their mind away from the pain completely. We talk to them about other things. We might relax them down and do something in their imagination. Then they open their eyes and say, well, how's the pain? And they go, oh, yeah, that's right. It's still there, isn't it? So we've found through the use of hypnotherapy that we can actually take people's minds away from their pain for a good part of the day, and at least take it away from the main throbbing type of pain that a lot of people feel. And when their mind is elsewhere, their level of pain is actually reduced, and they often become freer to move around, and they're in more comfort. So we use a lot of hypnotherapy for pain reduction in so many people.
Interesting, isn't it? I mean, I've seen you or heard you describe the way hypnotherapy can be used for all sorts of conditions. And usually it's to do with addiction or changing behaviour. But in this time, I suppose it's in distracting people, is it?
It is, and it is a little bit like a change of behaviour, as you mentioned, because when we're in discomfort, say we do have a problem with our knee, hip or back, we're aware of that. We've got to be careful how we stand, how we walk, how we sit, how we bend. So we're always continuously thinking about that. And when our mind is focusing on that area of discomfort, then the discomfort can escalate. Whereas what we do in the hypnotherapy session is to basically dial down the pain, if you like, give the person the mind control to actually lower their pain, to think about other things, to get on with their life, being somewhat aware that they've still got to be cautious, but to take their mind away from that area that is causing them restriction or concern. And when we can do that, then the level of pain that a person experiences on a day-to-day, hour-by-hour basis is considerably reduced. And look, I've had people come through that have gone from pain medication 2 or 3 times a day to basically no pain medication at all.
Really?
It's amazing how it helps. My husband had a leg osteotomy about 10 years ago, knee osteotomy, and he was given all sorts of endone and Panadol Fort, all sorts of things. I did a couple of sessions on him. That was 10 years ago, and he's still walking freely. He still doesn't need a knee replacement that they told him he would need, and he takes no pain medication whatsoever. He walks every day with me, and he even surfs. And he knows that there's a tightness there. He knows that he's got no cartilage on one side, yet his mind has been taken away from that pain and concentrating on the pain. So he's able to get on with his life incredibly well, and a lot of people can.
What's the trigger for when people would, I guess, access what you're offering in terms of hypnotherapy, be it one of your recorded sessions or a session in person? Do you do it regularly as a routine, or do you do it when people are feeling the pain? The trigger is the pain.
Normally people will come for hypnotherapy when everything else has failed, which is quite regrettable, but that's what normally happens. When they come into the room, they're usually in some degree of discomfort, or that when they listen to it on a recorded session, they're in a bit of discomfort. But I suggest normally people listen to a session 2 or 3 times over a few days or a week, and that way the suggestions are being embedded deeper and deeper into the subconscious part of the mind. And then what they do is they start to walk around and get on with life, and then they'll remember, oh, that's right, my pain's not there right now. And then they're able to dial it down themselves. If the pain does start to escalate because they're thinking about the area, they're able to then take it down themselves and think about other things. Your mind simply goes to another place. So
by using the recorded session repeatedly, people are training themselves, I guess, in some ways. Yes, they do. Look, some people only need 1 or 2 sessions and they're fine. Other times they may do something that they strain that area and it starts to inflame again. So they go back to the recording session again, they listen to it, they get topped up, if you like, and then they continue in with their life a little bit freer, easy, and certainly more relaxed. I mean, the worst case that could happen is that you receive a relaxing session to recharge and revitalise yourself. That's the worst case scenario. Right. 131873. Now, Jeff, what's your question for Karen?
Osteoarthritis, please.
Oh, Jeff, hi, how are you? You poor thing. Osteoarthritis is a horrid condition.
My doctor suggested I have hot and cold. It's my right knee mainly, but it brought... like, the only relief I get, and I don't abuse them, is Panadol Fort. I only take one when the pain gets really bad.
Yeah, that is a very strong medication.
Yeah.
I could only recommend that you give the hypnosis session a go. It can only help you. Worst case, it will relax your body and also relax all the muscle.
And how much do you charge, dear?
Well, to do it on the... I'm
in a private health scheme, but I'm a disability support pensioner.
Yeah, this is a little different to that, I guess, Jeff. I mean, essentially what you're talking about with the hypnotherapy, isn't it, Karen, that you've got the medical profession, which obviously Jeff has been to, and this, if that's not 100% being satisfactory, this is an additional way of helping you tackle pain.
That's right. We actually have a lot of doctors refer patients to us to help, sort of reduce the pain, particularly when doctors say, well, look, I really don't know, sir or madam, that you really should be in such discomfort. And then they recognise that the person is concentrating all the time on that area and they really need a hand. But, I mean, tonight I've got an offer for everybody. If they just put in the code word comfort, then they can get the hypnotherapy pain session for their device or their phone or their computer for like $12.
Yeah, well, how's that? So, Jeff, when it comes to your pain, does the doctor understand the level of pain you've got, or does he say that you're feeling more pain than you should?
It's not too bad on the warm days. Like tonight, it's not too bad.
Yeah.
But in the middle of winter, or those cold nights,
well, that's the problem with arthritis, isn't it? Yeah.
Oh,
it's agonising.
Yeah.
But no, I mean, certainly give it a go, Jeff, and try the session. As I say, I'm sure you will be helped, and the osteoarthritis in the knee area will be reduced. Your mind will be taken elsewhere. So even though you've got to be cautious walking around and doing things on your legs, obviously, it will be reduced, and you'll be able to have a more comforting level and healthier level, if you like, without having to take such strong pain medication on many days.
Okay, good on you, Jeff. Thank you for your call. What's the code word again there, Karen?
Comfort.
Oh, there we go. It's easy to remember, isn't it?
Yeah. So you just get that from Dr Karen Phillip, drkarenphillip.com, and there's a little link there to hit just under the 2GB icon, and people can grab that and start using it straight away.
Yeah. It's interesting. This is the first time we've talked about a type of area that you treat that it hasn't been, I guess, a behavioural issue. It's been more of a physical issue.
Yes, it is. It is certainly physical, but strangely enough, a lot of times chronic pain does then generate into behavioural. It becomes almost habitual.
Well, of course it does, because it's debilitating. Yeah.
Oh, it can be so debilitating. And if you've had pain for a few months, we almost train ourselves to expect it.
Yes.
And when we do that, it does become a behavioural matter. So when we can intercept with some hypnotherapy to change the mind, if you like, we've got a saying, change our mind, change our behaviour, change our body.
Yeah.
And that's exactly what it does.
There we go. Okay, well, that code word, as you said, is comfort.
Comfort.
And the website, drkarenphillip.com, as in drkarenphillip.com. We'll chat next week.
Thanks, Warren.
There we go. One of our regulars as part of Saturday Nights with Warren Moore.